ask you to do a postural check. So just standing and just feel what's going on through your body. So through your feet, I just want you to feel where the weight's going. So through your heels, through your toes. Is it going more to the outside of your foot, the inside of your foot? And just check the way your arms are hanging. So I want you to get some awareness about what's going on in your body. Are the knees lining up? Do your hips feel like they're square? Are your shoulders feeling even? Does one feel lower than the other? What's your head doing? Is your head straight? Does it feel like it's tipping to one side? Even your hands, does one hand feel lower than the other? So just getting an awareness of, just a quick scan of what's going on right through the whole system.
Do you want to say what's wrong with me?
What are you feeling, Matt?
I'm just feeling a little bit like my hips are a little bit out, so I've got more weight on my right toe and left heel.
Yep. Yep. So that's a common finding. So if you're a right-handed golfer, you might feel the right toe, the right toe has got more pressure and the left heel has got more pressure. And what that often means is there's a bit of rotation through the pelvis, a bit of rotation through the shoulders. So sometimes we call that like the pelvis being a little bit open, meaning it's facing the target. And as a result, you might end up with shoulders that rotate the opposite way. So you end up with shoulders that are closed. So you're shutting yourself off. So that twisting pattern is something we see really commonly in golfers, but making Matt or making anyone think about that is really important, because they can sort of pick up what's going on with me today before I even have a club in my hand. So that's really important. So the second thing I want you to do is a free squat. So can I get you to just have your arms out in front? Great. And just do a squat just to where you're comfortable. Good, and come up. Do it again. Do 3 of those and just have a feel of what do you feel in your body is actually stopping you getting down a little bit further. Where do you feel like the handbrakes are? What won't allow you to move freely? What are you feeling now?
So I can feel that just in my, as I go down in my sort of right QL.
So the low back, yeah?
Lower back.
So can you face the wall, Matt, just so we can see side on what that looks like? And just hold it at the bottom. Okay, so more through the low back, you're feeling tight.
Yep.
Yeah. Okay, good, come up. So that's a good way to screen yourself, and just quickly check feet, ankles, knees, hips, spine. So that's as a test for yourself to sort of pick up what's tight today. That's a good way to start. Okay, so now I'm just going to get you to just touch your toes, Matt. So just bending forward, reaching down for your toes. So everyone at home doing the same. Again here, what's stopping you getting further there? Do you feel restricted through your spine, through the hips, through the hamstrings, the calves, coming up? So nice and easy, do that again. So I'll get you to do about 3 of those, and just again, get some feedback. What's going on through your body? What are you feeling? So again, Matt, where did you feel that's most restricted?
A little bit through that right QL
Same.
again, and
Yeah.
a little bit through the hamstrings.
Yep. Okay, so Matt's pretty good there. He can get his hands all the way down to the floor with straight legs. That's pretty good for most people. So you only need to go to where you're comfortable. So we do refer to that as a toe touch exercise, but you don't have to actually touch your toes. So just allowing the spine to roll down into that position is sort of asking for mobility from all the segments of your spine and from the hip. Okay, so now we're going to move to the wall. So Matt, can I get you to go up against the wall? And we're going to go into a calf stretch. Yep. So, yep, nice, just lunging towards the wall, so you can just move that foot forward a little bit more. So keep your back heel down on the floor, stretching through that back calf, and make it dynamic. So we're just going to lunge in and out, just teasing that back calf. And get an awareness of what that feels like through the ankle, through the calf muscle. So just going to do a few of these. And remember how this feels. Swapping sides, we're going to do the same on the other side. So our calf and ankle mobility is super important. If we don't load our feet and ankles well, it's really hard for us to generate power. So again, this is something that often goes, I suppose, it goes by the wayside, and a lot of players don't think that it's that important. but that ability to actually push their feet into the ground and work against the ground, and then they have that power come up through their body and out, is really crucial. So this is probably, the ankle and foot mobility is really important. If you don't currently do this, you really should start. So let's go into our leg swings. So from here, want to make sure the feet and ankles, and some of us might get sore feet from playing golf. So this is another really good warm up for our feet. So we're going to go into a leg swing. So as you can see, Matt's doing there. So he's standing on his right leg, swinging his left leg across. And I want you to see, if you can see the movement going through his foot here, through his shin, through his hip. So the movement through the foot, the toes stay down, the heel stays down, but the midfoot is moving. So you should feel like as you swing that leg across, your arch is lifting up off the floor and it's creating. So Matt, can you get into your top of your back swing for me, please? Just so in that position. Okay, so if we look at what his right foot's doing here, and his ankle and his shin, we're creating that same spiral for that warm-up exercise we just did there. So if you can go do the left side now, so swap sides. So this is reinforcing the pattern we want through the foot, the ankle, the shin, the knee, and the hip. So this is now for his follow through. We want this leg to do the same thing when we follow through. We need the foot and ankle to give us that mobility. And if they don't have it, we'll often get pain on the outside of our knee or the outside of our hip because the foot and ankle aren't doing their job. We're having to recruit it from somewhere else. Cool. Okay, so so the shoulder taps, we'll go against the wall. So these shoulder taps, you can adjust how far you are from the wall. So the closer you are to the wall, the easier they are. So to start off with, push into the wall with your hands. So this requires you to activate through the shoulders and the muscles all around the shoulder blades. So if Matt, I can get you to step back. So then you can step back a little and you can alternate your shoulder taps here and do the same thing. It requires a lot more trunk control and stability. And you can go all the way down to something lower like a Swiss ball, and you can work your way down to the floor and do the same thing where you're having to really try and anchor, so let your hips drop a bit more. This will challenge you. Go there, Matt. Nice. That's really good. So again, just to fire up all the muscles that stabilize the trunk. Well done. That's great. Okay. So with your back to the wall now, we're just going to do some wall slides. So this is a good posture check. So standing up against the wall, ideally you can get your elbows back and your wrists and your hands back. So try and not have a huge arch through that low back. Try push as much of your body onto the wall as possible. So nice and easy, we're going to slide up and down. Good. What do you feel there, Matt?
A little bit through my left shoulder.
Yeah.
And I can feel through the sort of my lats, back, a good sort of activation stretch.
Yeah. So this is also, yeah. So if you're tight through the chest or the front of your body, or if you're doing a lot of computer work, working from home, this is also a really good exercise to just open you up and just get the shoulders to sit back a little bit more. But we need to have this openness so we can actually get our arm back and up away from us through our swing. So we do need this length through our pecs and our chest there. Yeah? Awesome. Okay, and the hip hinge. So this next exercise is really important. Actually, I'll get you to get into your setup position at the moment and just check how you're feeling after we've done the foot and ankle work. And just recheck your setup and just see how it feels now compared to what you had before. Do you feel any different, Matt?
Yeah, I can feel that my legs are a lot more activated. And that goes all the way through up. So it kind of starts from the feet and then moves all the way up through the body.
Yeah.
So I feel like I've got a good, strong, I guess the ground force is really good. So through my legs is, which will allow me to make a good full turn and get back.
Good. All right, let's work on hip hinging. So again, so with your back to the wall, yeah. So I'm going to get you to place one foot in front of the other. Good. Now bring your back foot out so your feet are shoulder width apart. Now find the wall with your hands. Good. Can you lean your hips into the wall? Great. Now head up, looking at me, good. Can you turn your hands up this way, thumbs up? Great. So as soon as you do that, you should feel all the muscles working from the neck, all the way down the spine, all the way into the low back, all the way into the hips, and hamstrings should be nice and stretchy there too. Can you feel them?
Yeah.
Good. So if I say to you, keep your knees straight and bring your hips just off the wall. Keep them as close to the wall as you can, without touching. Keep turning those thumbs up and keep breathing. So everyone at home too, making sure you're not holding your breath, breathing in and out. I want you to hold it here for 5 breaths. Keep looking up, keep squeezing those shoulder blades, keep turning those hands up. Great, stand up there. Good, do it again. And do 3 of them. Find the wall. So hips to the wall, knees stay straight. Good. Hinging forward, hips just off the wall. Great. 5 breaths here. Big breaths. So feel that breath filling your whole rib cage. Feel the whole rib cage expanding when you're breathing there. Keep working those fingers back towards the wall. Still want all those postural muscles turning on for us. Good. One more, Matt. So maintaining a good hip hinge all the way through is super important. This is what allows us to maintain a good spine angle so that when we're rotating, we're not coming up early. That early extension is often because of a poor hip hinge. So this is a pattern we're training. We're training the muscles at the front of the hip to work to hold us in that nice hinge position. We're training our postural muscles to fire to support our spine. And if this becomes easy, then we do it in our setup all the time. So after doing that, take your setup again now and just see how you feel. So Matt, what do you feel there? Is anything different?
Just feel a little bit more. It's going up the chain more.
Yeah.
So
the activation?
Activation up through my back.
Yeah.
Yeah.
How does it feel through your legs, through your hips?
Yeah, legs feel really strong.
Yeah.
So.
Great. So if I just asked you to stand and recheck your posture standing.
Yep.
Yeah. Do you feel any different to when you first stood and I asked you to check your posture?
Yeah, it's more evenly balanced through my feet. So I'm not as much on that left heel and right toe. It's more sort of through the mid part of the foot.
Which is great because without needing any treatment, he can run through this routine and help align himself, which is what we're trying to achieve with a really good active warm-up that's specific to someone like Matt. Okay, so we're going to move to a pretzel now. So you're going to need to be on the floor for this one. So I'll get everyone lying on their right side to start with. Okay, so I'll just talk through what I give you, so come back to straight. Yep. So just laying on your right side. Can I get you to take your top leg forward, your bottom leg back, so scissor those legs. Great. Now your right hand's going to hold on to your right knee, your left hand's going to reach for your left foot. Excellent. So breathing in and out here. As you breathe out, Matt, drop your left shoulder to the floor here. Turn your head to the left as well. Good. So breathe in, breathe out. So with this position here, Matt's rotating his shoulders left relative to his pelvis, which is turning right. So we're asking for opposite things to be happening through the upper and the lower body, which is exactly what happens in our golf swing. So if you're having trouble grabbing that foot, feel free to use a band or to use a strap or anything you may have. Even a hand towel might work. Sorry, you say that position again?
Oh.
Yeah. So from this position here, I'm going to ask you to think about your breathing. So again, your rib cage in this position, obviously we're winding it up. So if I ask you to take a deep breath in, you're actually going to feel it's going to be quite restricted, but I want you to feel like you're breathing into those lower ribs. So through Matt, I might say to him, breathe in through this area. Matt, take a big deep breath in. Good. And as you breathe out, try and draw this shoulder down a bit more. Try and get that opposite knee down a little bit more. So he's feeling this lengthening happening across his spine. So this is the same position his spine needs to be in to get to the follow through position. So he's got to rotate left through his spine, which is what he's doing on the floor. So if you're finding this position quite restrictive or quite difficult, you might have a similar issue once you're standing and we've got gravity acting on your body and we've got load and momentum from a golf club and speed and all these other things, and we're trying to get to the same position. So if a position is easy on the floor, it will be easy when you stand up. If it's hard on the floor and there's no gravity acting on your spine, it's going to be also hard when you're standing. So this exercise here is excellent for anyone who plays any rotational sport. So let's flip over to the other side. So same thing, let's scissor the leg. So the top leg goes forward, the bottom leg goes back. This side's tighter, Matt.
Yeah, just a little bit.
So same thing here. So now if we think about it, this is Matt's backswing position. So getting to the top of his backswing is not as good for him as getting to his follow through position. And again, we'll go easy on him because he hasn't done much for the last few weeks. So
I can feel really sort of up through here.
yeah, so he's feeling some tightness through the right side of his low back. You also might feel a stretch on the quad on the bottom leg, the hip flexor of that bottom leg. So again, focus on that breath, feel that rib cage expanding, thinking about that lengthening. What part of your body doesn't like this? Where is the tightness? What feels most restricted? For some people it might be shoulders, it might be chest, it might be ribs, it might be low back, it might be glutes. It might be different for everybody. So just thinking about what part of your body doesn't really love this, and if you have trouble getting to the top of your backswing position, again, this would be the side you might focus on a little bit more. And with all your exercises, there's nothing wrong with doing more on one side if that side's tighter. Okay, great. So I'll get you to come up against the wall for the next one. So progressing that rotation we've just worked on, so just kneeling, I'm going to get you to do the thoracic one. So right foot, right knee bent at 90 degrees. Good. Left leg out in front of you at 90 degrees. Actually have that hand on the floor for me. Right hand on the floor. Good. Left hand's going to come up. Great. We're looking up at the wall. So we include the neck in this as well. So we're getting still good trunk rotation. The wall stops you from tipping, so I recommend this exercise against the wall. Breathing in and out again. If you can't breathe comfortably through an exercise, you've gone too far. So back it off if it's too difficult to the point where you can breathe, because then the nervous system's actually okay with it. So breathe in and out. Good. Bigger breath. Okay, great. So let's rotate over. We're going to do the same on the other side. So the knee that's closest to the wall goes down on the floor. And the opposite leg, yep, out in front, 90 degrees. Same thing. Breathe in and out. So you can lean on the wall to help you. Excellent. So now we've done the 2 rotation exercises for our thoracic spine. Come back to your setup position, recheck that, and just see how that feels. And Matt, can you give us some feedback about what you're feeling?
Yep, so strong through the legs.
How's that activation feeling sort of?
Activation's all the way up through the body now.
Yeah? Yep. Yeah, great. Excellent. So slowly we're building up and making sure that every part of his body is getting ready to play and feeling nice and loose. So now I'm going to ask you to go through your swing. So just you can grab your club if you like and go through your back swing all the way to your follow through. Just do a few swings where you are. So if I asked you to do 5 and start to feel the effects of the work that you've done. How's that feeling, Matt?
Good. Probably feels, I would say if I had a limited amount of time, I'd be better doing this than going to the range and hitting balls before I start.
That's great. Awesome. Okay, so now I want you to get to the top of your backswing and hold it there. Good. And now, can I get you to just do a little squat for me, up and down? Just a little half squat. Good. Great. So I want you to do, at least 5 of these. And I want you to feel that the knee's pulling out away from you. So we're exaggerating everything, remember? We don't need this much squatting normally. But I'm exaggerating it because I want you to feel your right glute working. I want your knee to be pulling out towards me. I want your shin rotating towards the side there. I want the arch lifting off the floor. I want all this torque and all this torsion all the way up from the ground, all the way up to the hip, through the spine. And to exaggerate it even more, I'm going to say chest out. And do the same thing. Stand very tall, look up, look up. Do the same thing. That will amplify what you're asking from the spine, from the hip, all the way through that leg. Okay, great. Excellent. Come back and let's do the same thing with our follow through. So get to your follow through. Hold it there. Now do the same thing. Half squat. Great. So feel that torque again from the foot. Feel that foot into the ground. Feel your shin rotating. Feel your knee. Feel your hip. That big spiral all the way up the body. Excellent. That left glute should be really working there for you. Feel that turning on. Great. Okay, come back to your setup mat. So go through your swing again now after activating both your glutes, both your hips and everything that attaches to the hip joint. From the ground all the way up to the glute and the spine, we've sent that message. Good. Yeah, feel okay?
Yeah, feels good.
Nice. So let's go arms overhead with your clock.
Yep.
So if I ask you to just do a step over, so if I ask you to step your left foot across your right foot, allow your right hip to push out to the side and your arms to go to the left. Good. So just getting all the tissues on the outside of the hip happy to be nice and long there, so come up. Good, and you can do that as a repetitive thing. So step the foot back in between. Good, and that's it. So step over and bend. That's it. Great. Do that again. So if you have issues transferring your weight or getting to your right side, this is a great position to get into. So it's just a step over lunge. Good. Let's go the other way. So if you have trouble transitioning and getting your weight across to the left, that's it. So go the other way. So step your foot over there. That's it. So transferring all your weight onto that left side. Great. So just practicing weight shift. That's what we're doing here. And just getting all the tissues and making sure the capacity of those tissues is allowing you to actually physically get to that spot. Great. Okay. So we're coming on to recheck your setup now after having done that. Go through your swing again. Looks so good. I'm a bit jealous.
Nice a ball attached.
Okay, so let's do our squat and rotate. So to start with, we'll use the club with this one. So if you can just actually have the club in front of you. Yeah. So I'm going to get you to hold your club and go into a squat. Good. And now rotate your hand up towards the ceiling, one hand at a time. Good. And come back. Alternate to the other side. Good. Keep sitting into your hips. Keep rotating side to side. So if you're feeling like this is quite comfortable, you can bring your hands down. You can drop the club. So can I get you to go a bit wider with the knees? Hands on the floor. Have your elbows in between those knees. Great. And now rotate up there. Excellent. So we're aiming to get that arm up nice and vertical, which Matt's doing. Go the other side. So again, this is an exaggerated version of what the body needs for a good follow through. And this is the exaggerated version of what the body needs for a good backswing. So having that nice alignment there. So if either of these if one feels a lot harder than the other, feel free to work one side a lot more. So if the ground's too far, you can press on something, you can hold something in front of you like a foam roller, or you can use your golf club, or you can just use your golf bag. Have something there that you can press on. Good, stand up there. Okay, so grab your club now. So that was the last one of the warm-up. So we finished with the squat and rotate. So get into setup now. Talk about the setup now. Like, what are you feeling through your body?
So now through my body, I'm really feeling almost like both my feet are screwed into the ground. So and almost like they rotate out a fraction, but
yeah,
obviously don't do that. But
the feeling is there.
The feeling is there,
yeah.
And then that goes all the way through the legs. So it feels like my glutes, hamstrings, thighs, all switched on. So I feel like I'm in a really strong position here. And then as I go back to the top from this position here, it almost feels like the power goes from my left heel all the way up my right hand.
Perfect.
To get a good range on my backswing. And then once I get to there, then I can just let it all go. So, and that's through all those exercises that sort of all built those feels for me.
Yeah, great. So if you go from just doing nothing, just sitting in the car and straight to the tee, you don't get any of those feelings. You don't get any of that awareness, any of that firing, any of that activation. So all those things that Matt's talking about are super important. If he does the same thing every time he plays, every time he practices, the warm-up always needs to be consistent, so therefore your swing doesn't change, and when you set up over the ball, you always get the same feeling, and that's where consistency comes from, which is what everybody wants. So I think it's really important understanding how routine you have to be with your warm-up so that the feeling and the awareness is always the same. And now, if you like, I'd like to give you a couple of minutes just to quickly re-tape yourself and see if you can just record yourself again, getting into your setup, and just so you've got a comparison of before and after you did your warm-up. Does your setup look any different? And thinking about how you felt when you first set up versus how you feel now. So working on that awareness and spending that time to actually go through what that feels like. So if you'd like to do that now, and then we've just got a couple of things to finish off with.